Governor Murphy, when you're ready.
Thanks, Michelle. Good afternoon, everybody, and Happy New Year. Starting the year 2022 with the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persicelli, her colleague, another familiar face, the Communicable Disease Service Director at the Department of Health, Dr. Ed Lifshitz, and a guy who needs no introduction, the Superintendent of the State Police, Colonel Pat Callahan. Speaking of Pat, he'll give us a weather update. We've been at it on the weather front intensely since before yesterday, but really since yesterday. State of emergency in a handful of counties. The state's Emergency Operations Center under Pat's leadership was activated at midnight. Just to be safe rather than sorry, state workforce came in late today at 10 a.m. I've been back and forth with mayors. Paul Hodson of Egg Harbor Township comes to mind, Lenny Desidero, Sea Isle City, Albert Kelly in Bridgeton, Gary Quinn, County Commissioner Director in Ocean County, Denny Levinson, County Exec in Atlantic County, among others. This is a little bit, I'm in central Jersey and Monmouth County, a tiny, tiny bit of snow here, but they are getting clobbered in the south. Could be as much as double-digit inches when this thing is said and done. So if you're down there, stay strong. We expect little activity in central and northern Jersey. That's not to say we won't have anything, but it won't be remotely what we're seeing in the south. Ready.nj.gov. If you don't have to be out, don't go out if you lose your power because there are high winds. Don't assume someone else is calling it in. You should call it in. If you see a down line, don't go near it. Call that in as well. Probably Pat will get into this in more detail, expecting some coastal flooding as well as a part of this. So a storm that's significant, and it's principally a South Jersey storm, but everybody out there, be careful and keep your eyes peeled. I want to thank everybody who has reached out both to the First Lady and to me to get to the First Lady over the past 24 hours with well wishes since her positive test yesterday. She continues to be asymptomatic and in good spirits, and God willing will remain so. But certainly this occurrence necessitated that we move today's briefing to its virtual format. I have tested negative. I tested today negative, yesterday negative, a handful of days ago. I think 3 negatives in 6 days. And we'll both continue to test regularly, and we'll closely continue to adhere to all CDC guidelines during this time. A couple of lessons pop out from Tammy's experience, which I'll come to at the end of my remarks. With that, we get a lot of ground to cover. First of all, again, Happy New Year. On Saturday, January 1st, I formally notified leadership in the Senate and Assembly, respectively, to extend for an additional 90 days our administration's emergency powers related to vaccine distribution and administration, testing, and ensuring adherence to CDC guidance, particularly as it relates to masking in vulnerable settings, including our schools and child care centers, where we know there are large numbers of unvaccinated individuals. I also requested a 90-day extension for a number of administrative orders, directives, and waivers that have been issued by our departments and agencies in response to the pandemic. This request is, by the way, in accordance with the law I signed last June that allowed for the formal declaration of a public health emergency to expire while ensuring that our administration had the necessary authority to continue to fight the pandemic. I'm grateful for the attentiveness and partnership of Senate President Steve Sweeney, Assembly Speaker Craig Coughlin to this request, and we will continue to work closely with them and with their leadership teams. This Omicron tsunami has changed the game yet again. We cannot summarily give up the fight. We need to remain on a war footing to ensure that we can get resources to where they need to be and when they need to be there. And yes, this means that we anticipate our kids having to wear masks in their schools for now in order to protect their health and safety and ensure that they can continue in-person learning. This brings us absolutely no joy. No one wants to see our kids' smiles more than I do, but this is what is necessary now to keep our schools safe, and I'll have more on those efforts in a few minutes. With the exponential surge in our numbers, it would be the height of irresponsibility to lift these basic public health requirements at this time, and we will not let that happen. Let's now jump to those numbers and start with a look at what is happening in our hospitals. As it has been throughout the pandemic, ensuring the ability of our healthcare system to serve those who are the sickest is among our very highest priorities. Over the past week, as you can see, we have seen a more than 50% increase in the number of individuals hospitalized for COVID-19, along with significant increases in both ICU and ventilator counts. That's one half of this equation, albeit, as I said, the half that we're watching most closely. The last thing we can allow is for our hospitals to be overrun. The other half, of course, is the staggering numbers of new cases that are being reported every day, as you can see here. Today, the Department of Health is reporting 22,625 new cases in total, but we know that this is a dramatic undercount, as most people testing positive through at-home test kits are not reporting their test results to local health authorities. So look at this number as a floor. And here is what we need everyone to really take to heart: the need to mask up, to get boosted, and to just practice common sense. Yes, the data shows us that illnesses due to Omicron do not lead to hospitalization at the rates that we had seen with prior variants, and most directly when compared against Delta. But, and this is a very big but, when we are seeing case counts as high as we are, and knowing the real number is much higher, whatever solace we get from a lower hospitalization rate, frankly, goes out the window. The sheer numbers of new cases are directly leading to hospitalization figures we have not seen in well over a year. Here again are today's hospitalization numbers compared to 1 year ago today, and on the far right side in red, compared to the worst day of last winter's surge. We have more people in the hospital today than at any point in the past year, and the most since early May of the year 2020. And then let's compare the case numbers from today. Again, we know this is an undercount, against 1 year ago, and then from the height of last winter's surge. The numbers we're seeing today blow anything we have seen since the start of the pandemic out of the water. And yes, folks are still dying. Here is the latest numbers of confirmed deaths over the past week. Again, these are confirmed. This does not include the losses of life in our hospitals. By way of example, yesterday our hospitals reported 16 yet to be confirmed losses of life. And you can see the total numbers are bearing down on 30,000 blessed souls lost from our state. So our message is simple. Take Omicron seriously, wear your masks, get your booster, don't take a cavalier attitude, and go get tested. The symptoms between a cold and Omicron may not be much, but there is a world of difference between the two. There are more than 1,000 testing sites open across the state. We are aware that many have long lines or few open appointments, and to be sure, this is an issue in literally every American state at this moment, frankly, probably in every country around the world. And we continue to work to expand accessibility with our partners at the local, county, and federal levels. I will be on with the White House tomorrow morning, by example. To find the testing sites nearest to you, go to that website, covid19.nj.gov, and click the link for testing at the top of the page. And as for boosters, we are continuing to see more and more people getting boosted, which is a good thing, but with only little more than 45% of those eligible having gotten their boosters, this number is not going up as fast as we either want or need it. There are more than 1,900 locations across New Jersey administering vaccines. And again, we have made it easy. Go to covid19.nj.gov and click the link for vaccine info to look for the clinics nearest to where you live or work. The fact is that right now, if you are 6 months out from your primary vaccination course of Pfizer or Moderna, or 2 months out from J&J, you are no longer fully protected. The efficacy wanes over time, and you are vulnerable to Omicron or even Delta, as that has not entirely left the building either. We see this in the slowly increasing number of new infections reported in individuals who had completed their primary vaccination courses. Over the week of December 13th through December 19th, as you can see, and this is before the Omicron tsunami really began, more than 1/4 of new infections were among those who had completed their primary vaccination courses. Thank God, 1 death is too many, but only 1 loss of life out of the statewide total of 136. Anecdotally, from the daily reports we're getting from our hospitals, roughly 70% of those showing up for treatment in a hospital are unvaccinated or not completely vaccinated. These folks continue to be the primary driver of the numbers of hospitalizations, intensive care unit beds, and sadly, deaths. And as Dr. Ed and his team at the Communicable Disease Service parse through that data, we'll get a more complete picture in the coming weeks' breakthrough reports as to how many of these hospitalizations among vaccinated folks are for a COVID illness, especially whether they have received a booster, as opposed to hospitalizations for another reason and that they test positive for the virus anyway. But this is the snapshot that we have. Thankfully, though, we continue to see a remaining protection against hospitalization and death in these individuals, as the numbers show. And here are the complete numbers of breakthrough cases dating back, as we do every time we gather, to January 19th, 2021. Now, I know one area that a lot of people have concern with is our schools. We understand that completely, many of which return today for in-person learning. And yes, we know that these schools are also going to be dealing with a lot of absences of both students and staff who have contracted Omicron during the tidal wave of new infections. Even before our schools let out for the holiday break, the infection rate, as you can see, among both students and staff in general was increasing. These are overall rates, and these are total cases regardless of where the exposure occurred. We're not distinguishing in this case between in-school transmission or from other location. And by the way, let's also acknowledge the last column is for a partial week for most districts. But, and again, this is a big but, the numbers of outbreaks directly traced to in-school activities have remained below where we would have anticipated given the speed and upward trajectory of Omicron. This speaks directly to the importance of the layered approach to student and educator and staff safety that we have had in place in our schools since they opened in August and September, especially to the importance of proper masking. And keep in mind, while each one of these cases we take with deadly seriousness, in the state, we have more than 1.4 million students and over 3,500 different school buildings. Let me be clear, we currently have no intention or plan to shut our schools. We have no desire to return to remote learning, which is suboptimal, as we all know, in terms of learning, instruction, and learning loss. Certainly, individual schools and districts may make their own decisions after consulting their own local health departments, and some are starting the second half of the school year in remote fashion. But we will do everything we can to keep our kids in school, where not only we know they will have a more appropriate educational experience, but where the data actually shows they can be kept in an overall reality safe. So to ensure that we can keep our schools open, Judy's team at the Department of Health distributed guidance to all district and school leaders on additional steps to take when in regions of very high COVID activity on the Cali score. The department also issued guidance over the weekend regarding the test to stay option for keeping students rather, in their classes. I'll let Judy go into greater detail, but here is the broad view. Test to Stay pulls together contact tracing and testing to allow an asymptomatic student who was determined to be a close contact of another student who was tested positive to remain in school if they test negative. And any student who is remaining in class through Test to Stay must comply with both testing and masking requirements and should follow all CDC guidance for keeping away from others when not in school. Test to Stay is an additional level of protection to keep our schools open and our kids learning in their classrooms. But the bottom line remains that nothing is as vital as vaccination, and especially for teens who have been eligible for a while, boosters. So let me sum all this up. Do not take Omicron lightly. Our hospitals are seeing numbers they haven't seen in more than a year and a half. We're seeing new case counts that dwarf what we were seeing even in the earliest days. The fight is not over, but we can shorten it if we all take this seriously. Mask up, get boosted, and again, take this seriously. Before I move on, I want to come back to Tammy's circumstance. We, by the way, as a family had just tested literally a couple of days before. We heard that somebody in our inner orbit in New Jersey, a non-family member, came to us on Saturday afternoon and said they had each tested positive. We then arranged for tests on Monday morning. Tammy came up, by the way, no symptoms, came up positive. She took another test this morning and came up positive again. I came up negative yesterday and today, and I had come up negative a few days before, had all the other members of the family. So there were sort of two takeaways for us. Number one, this thing is crazy transmissible because Tammy had done and continues to do all the right things, not just masking, double maskings, social distance, double vax, boosted, the whole shooting works. That's one lesson. Don't underestimate how easily you can get infected from this thing. But the other lesson, as I sit here and please God, this continues to be the case, she had no clue that she had it. Zero symptoms. She still has zero symptoms. To me, that's the bigger headline. If you do the right thing, you're double vaccinated, you're boosted, you do everything according to the guidance that we know works, you may get it because it's so crazy transmissible. But again, please God, this is borne out with her situation. But as of now, it is. You don't get sick enough to be miserable, or worse yet, go to the hospital, or worse yet, get really sick, or maybe even, God forbid, die. Get vaccinated, folks. Get boosted. That's the best, smartest thing you can do. Now, as I mentioned before, we reported another, with the heaviest of hearts, 12 COVID-related deaths today that are confirmed. Let's take a couple of minutes to remember some of those we've lost. Let's start with this man, Dennis McCullough Sr. He had called North Caldwell home for 21 years, and he passed on December 14th, last month. A standout football player at Clifton High, Dennis was president and owner of McCullough Contracting, Inc., which his father had founded and which Dennis elevated to being named the, and I quote, New Jersey Family Business of the Year for the year 2020 by Fairleigh Dickinson University's Rothman Institute of Innovation and Entrepreneurship. He also supported Clifton's youth football and baseball programs. He left behind his wife, Cynthia, I'll come back to her in a minute, and his sons, Dennis Jr. and Ryan, and I had the great honor of speaking with Dennis last Thursday. He also left Dennis's wife, Diana, and 3 grandchildren, Lucy, Ryan, and Jeremy. As we speak, Cynthia is currently fighting her own battle in the hospital against COVID. Please, please, please keep her in your prayers. He is also survived by his brother, Andrew, among other extended family. We are grateful to Dennis for a lifetime spent in service to his community, and may God bless him, watch over him. And at the urging of his son, Dennis Jr., please get vaccinated and continue to follow guidelines to mitigate the spread of COVID-19, and keep that Cynthia in your prayers. And today we also remember Joseph and Charles Shula of Hasbrook Heights. We lost them both in the pandemic's early days. They were father and son, Joseph on the right, Charles on the left. They were 101 and 71 years old, respectively, when we lost them. Joseph was a proud Army veteran and found a career in accounting after his service days concluded. Charles worked as a manager for the Bergen Record newspaper. They passed within a month of each other. Joseph's wife, Madeline, with him on the right, and that's Charles's mom, passed away last September. She had COVID early on, but she did not die from COVID. I'll come back to that in a moment. And you can't make this up. Today would have been Joseph and Madeline's 80th wedding anniversary, January 3rd. Unbelievable. Charles left his wife, Kathy, on the left. I'll come back to Kathy in a moment. His children, their children, Michelle and Michael, and I had the great honor of speaking with Michael last Thursday. Also, they were Joseph's grandchildren, as well as the next generation, Alyssa, Jenna, Drew, and Connor. In the early days of this awful pandemic, back when these folks passed in April and May of 2020, Kathy on the left had a double knee replacement. Her husband, father-in-law, mother-in-law were all in the hospital at the same time. Can you imagine? And Michael reminded me of something which was kind of poignant. All three of the losses of lives, none of them ever knew that the other had passed, just by the way it worked out. And sadly, his grandmother had pretty severe dementia at the end. So the combination of timing, the severity of the illness, and his grandmother passing in the way she passed, they never knew that the other ones had passed, which is probably the way it should have been. They were also survived by daughter and sister Joanne, Joseph's other grandchildren, and Charles's nieces, Lynn and Lori, and their collective kids, Christina, Melissa, and Michael. God bless all of them. We pray for them and keep them in your prayers. Finally, for today, let's give a quick shout out to Warren-based Spinelli Financial Advisors, another of the small businesses that has partnered with the Department of Labor through the Return and Earn program to get our state back working. Founder of this guy, Mark George Spinelli, recognized a need to hire another employee for his growing firm. And through Return and Earn, he was able to not only find that new team member, but to also offset some of the costs of their onboarding and training. And that new employee received a cash bonus, as well as the opportunity to work toward a professional certification and a fulfilling new career. That's exactly how Return and Earn is supposed to work. And we are grateful for George for being an early adopter. He and I spoke last Thursday. Check them out on the website, by the way, spinfa.com, S-P-I-N, F as in Frank, A as in Apple.com. And that's what I've got for this Monday. Again, we urge everyone to take the steps necessary to protect themselves and their families during this Omicron tsunami. Get boosted, wear a mask, use common sense, get tested, and stay home if you feel ill. And with the winter weather today, please take it easy on the roads, particularly in the South, and let the plows and spreaders do their jobs. The state of emergency declared for the counties of Ocean, Burlington, Atlantic, Cumberland, and Cape May remains in effect. But wherever you are, let's all stay safe. With that, please help me welcome the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor, and good afternoon, everyone. Well, the simultaneous spread of the Delta and highly transmissible Omicron variants, as well as increased holiday travel and indoor gatherings, have caused a tsunami of infections in the state. We are reporting record high COVID cases and test positivity rates. Emergency department visits and hospitalizations for COVID-like illness are also increasing for adults and children. The COVID activity level is very high in the northern and central regions of the state, and the southern part of the state is reporting hospital census higher than our peak in April of 2020. Also, we are seeing the highest number of pediatric hospitalizations that we have seen either with a principal diagnosis or admitted for another illness and testing positive for COVID. As of today, 102 children are hospitalized. 76 of those children are confirmed COVID, and 26 are persons under investigation. That number has nearly doubled over the last 7 days. The demand for COVID testing has skyrocketed, and emergency departments are experiencing high volumes of individuals seeking non-emergency COVID-19 testing. The emergency rooms are not COVID testing sites. Please go to the website covid19.nj.gov to find one of the 1,000 testing sites available around the state. Hospitals and long-term care facilities throughout the state are experiencing large staff shortages due to COVID. As a result, the department and the State of Office of Emergency Management are working with FEMA on requests for federal strike teams to support hospitals and with the New Jersey National Guard for strike teams for our long-term care facilities. We are getting many inquiries also about setting up field medical stations as we did in April of 2020. Our experience and lessons learned from the first surge taught us that expanding capacity off the site of hospitals actually strained the clinical staff. So we will keep the staff close to the hospitals by adding capacity in and around our existing hospital campuses, allowing us to manage the volume of patients more effectively and efficiently with the goal of assuring that all patients get the care they require. So we must do everything we can to reduce the spread of this unrelenting virus and protect those returning to work and school. Our greatest tools remain vaccination and testing. To ensure that access to testing is widely available for students, teachers, and staff returning to the classroom, the department took a series of additional steps last week. We asked all school testing vendors to be in as many schools as possible today and to be able to test staff and students. I sent letters to local health departments, the FQHCs and testing site partners, asking them to prioritize appointments and walk-in availability for children and their families this week. Sites were also asked to expand hours dedicated to testing children. I also held a call Thursday with the pharmacy retail chains, asking them also to prioritize testing of children. And as Governor Murphy mentioned, on Friday, we visited a new federal testing site that can test 1,000 individuals a day at 90 Halstead Street in East Orange. The state has also partnered with Vault Health to offer free at-home saliva tests. To order a test that can be shipped to your home, visit learn.vaulthealth.com/NJ. As of today, 463,457 residents have ordered test kits. However, due to a nationwide inventory constraints of test kits overall, Vault has capped the number of daily requests for New Jersey to 30,000 per day. If you try to request a kit and get a message stating that the cap has been reached for that day, please try again the next morning. We welcome the news that the United States Food and Drug Administration, the FDA, has authorized a Pfizer booster dose for children between the ages of 12 and 15. Additionally, everyone who received a Pfizer primary series is now eligible for a booster at 5 months rather than 6. In New Jersey, more than 256,000 12 to 15-year-olds have received their primary series. Starting next Monday, January 10th, over 155,000 of them, or 61%, will be eligible for booster doses. We are awaiting similar approvals for the Moderna booster vaccine as well. Also, based on FDA action today, children between the ages of 5 and 11 who have received a solid organ transplant or are considered moderately or severely immunocompromised are eligible for an additional dose of Pfizer 28 days after they have completed their initial series. We know that the unvaccinated remain most at risk of severe illness or death from Omicron. So please, get vaccinated if you haven't done so. If you have gotten the primary vaccine series at least 5 months ago, please get a booster shot as soon as possible. Only 45% of eligible New Jerseyans have received a booster. We must do better. And we encourage everyone to wear a mask, wash your hands frequently, Stay home if you're sick and get tested. As Governor Murphy mentioned, the department has issued guidance regarding the test to stay option for keeping students in their classes. Test to stay allows asymptomatic, unvaccinated students who were exposed to a person with COVID-19 in any school setting where students are supervised by school staff, indoors, outdoors, or on school buses, to continue in-person academic activities that are part of the regular school curriculum and provided during school hours. Students participating in Test to Stay are required to comply with enhanced testing and masking recommendations and should quarantine when not in school. If schools are considering implementing Test to Stay policies, they should have robust contact tracing in place and access to testing resources. They should also obtain advanced consent for testing of the students. Schools must report individual test results to local public health officials and to the individual who provided consent. This Test to Stay option does not apply to exposures that occur outside of school and in the community. We have also released new guidance for timelines for quarantine and isolation in exposed, not infected individuals. For unvaccinated individuals, or those more than 6 months out from their second mRNA dose, or more than 2 months after the J&J vaccine and not yet boosted, 5 days of quarantine and an additional 5 days of strict mask use is required. In very limited circumstances, when a 5-day quarantine is not feasible, it is imperative that an exposed person wear a well-fitting mask at all times when around others for the 10 days after exposure. This guidance does not apply to the schools. CDC will be releasing quarantine and isolation guidance for K through 12. The current guidance should be followed while we await CDC's new guidance. Boosted individuals, or those who have completed the primary series of an mRNA vaccine within the last 6 months, or the J&J vaccine within the last 2 months, there is no need to quarantine following an exposure. But you should wear a mask for the 10 days after the exposure. The best practice would also be to include a viral test for SARS-CoV-2 at day 5 after exposure. If the test is positive for COVID-19, the individual should isolate for the 5 days from the date of the positive test result. If symptoms occur, the individual should immediately isolate and get tested for COVID-19. If you are infected, the timeframes are, regardless of vaccination status, 10 days total. Isolate for 5 days. If asymptomatic or symptoms are resolving after 5 days, you can end your isolation. However, you must wear a mask around others for an additional 5 days. Moving on to my daily report, as the governor shared, our hospitals reported a high of 4,715 hospitalizations of COVID-19 positive patients and persons under investigation. We are reporting 3 new cases of multi-system inflammatory syndrome in children since our last briefing. There are 155 cumulative cases in the state, and one of these children is currently hospitalized. At the state veterans' homes, since the last briefing, there have been 9 new cases among residents and 3 COVID-related deaths at the Paramus home. 22 new cases among Menlo Park residents, and 1 new case among Vineland home residents. At our state psychiatric hospitals, there are 75 new cases among patients, 28 at Greystone, 27 at Ancora, 9 at Trenton, and 11 at Ann Klein. The percent positivity in the state as of December 30th is 32.2%. The northern part of the state reports 33.33%. the central part of the state 32.15%, and the southern part of the state 28.22%. That concludes my daily report. Please continue to stay safe. This virus is unrelenting. It searches and finds vulnerable individuals, and that includes individuals who are not vaccinated or are not boosted. So let's get vaccinated and get boosted to protect ourselves, our family, our friends, and most importantly, our children. Thank you.
Judy, thank you for all. You mentioned this, you and Pat and I were together on Friday in East Orange at the opening of a sort of a mega testing site. I want to thank President Biden and the federal team for standing that up. I was asked on Friday whether or not we'd be open to more, and the answer has got to be yes. And Pat, I'm sure, will back that up as well. I think particularly if we can get one in the southern part of the state. Secondly, we had a good call with the regional hospital coordinators and then separately with the Long-Term Care Association leadership. And you've really gone through a lot of the challenges that are being faced in each of those venues. And God bless our veterans. Let's just say that, as we should every time we gather. Pat, would love in particular for you to, if you could, to comment on two things. One is the weather and where it is and where you see it going. I mentioned earlier, and I know you know this, but the South has been getting clobbered this morning with snow. And then secondly, Judy, something you and Pat and I were discussing earlier, and Pat, you may want to throw a little color on this. People ask us a lot about hospitalization capacity. And back in the spring, summer of 2020, you know, one of the weapons was a separate field medical station unto itself. And that model is probably not going to be the model that we're going to be pursuing this time around, for the simple reason that staffing is a huge challenge. We'll remember in the spring of 2020, you know, we had a lot of people volunteering, healthcare workers from Florida and other places, nurses, doctors, even from some cases from outside of the country, to come into New Jersey and New York City at the time and be the bullpen, basically. Those days are over. We're all getting clobbered. There's nobody coming in that's not already in here. Potentially National Guard support, which is one area. We are hoping that FEMA can help us out, perhaps beyond that. I say that because any more color, Pat, you can add to the notion that Judy and you and I were discussing. The model this year, as long as this surge lasts, is going to be on campus, trying to find ways to get another 50 or 100 beds into an existing campus, or perhaps to set a tent up on campus at that particular hospital, as opposed to some unto itself field medical station. So any comments you've got, any of the above? And again, Judy, thank you for your comments and leadership. Pat, over to you.
Thank you, Governor. I will start with the weather. As predicted by the National Weather Service, the southern part is getting clobbered, as you would say, Governor, over 6 inches so far. I know the National Weather Service just came out with predictions of 12 to 18 inches expected in the southern parts of the state. I also know that Atlantic County and Cape May County coastal communities are under a coastal flood advisory. To that end, US 40, both eastbound and westbound, are closed right now, and traffic is being detoured because of the flooding down there. Upwards of a foot or above ground level is expected. That advisory will go into early Tuesday morning. I did have a call with all the county OEM coordinators and state partners yesterday. We activated the SEOC last night, as you said, Governor, at midnight, and our urban search and rescue staff remain ready with high water vehicles as well as snowmobiles. So as of about noon today, the troopers had handled 114 accidents and 185 motorist aids. President Fiordaliso let me know that Atlantic ACE was dealing with about 2,200 outages, which is now, I think, under 1,000. So that's trending in a good direction, but we may see that increase given the high winds and the expected snow. Again, upwards of another possibly 10 to 12 inches of snow down there. I do recommend that anybody should stay home if you can. If you have to go out, 511nj.org is a good place to go before heading out. And I also stress to our citizens with disabilities or access and functional needs to go to registerready.nj.gov, which is a phenomenal resource to let us first responders and emergency managers know where you are and what your needs may be during a disaster. With regards to the COVID response, Governor, certainly that East Orange site is phenomenal. And as you said, if we had our druthers, we'd have one down in the southern part of the state as well. And that hospital capacity expansion based upon what we're seeing in reality as well as modeling leads us to believe that a lot of hospitals are going to be asking for that. And again, that point, to your point about building those out in the existing footprint is key because of the nature of where we are with staffing as a state and as a nation. We are still pushing for those 10 strike teams of 15 members each, which would be able to literally go and do those rounds. We hope that 150 person request that we put through FEMA and HHS will review and hopefully come to an approval on that, because we can set up all the beds we want. If we don't have the medical staff to go out there and take care of patients, it's really going to be all for naught. So that is almost an hourly conversation between Judy's team and certainly our all hazards incident management team, and whether that's beds, the equipment to support it. I think we had upwards of over 2,000 beds last year from both the mothballed hospitals that we renovated, as well as the field medical stations and that we're in the process of just making sure that we're ready to go. And our urban search and rescue folks, along with the EMS task force, are it's our primary concern, Governor, as you well know. So continue to monitor the storm on the weather front and continue to monitor the COVID storm as well, Governor.
Yeah, redefining multitasking here on Monday, January 3rd. So thank you for all of the above. A variation on my comments in your very good color on densifying bed capacity on campuses is the fact that you made the point, Judy's made it as well, staffing is likely going to be our biggest constraint here. And folks need to sort of get their mind around that, as opposed to, we'll continue obviously to show you the bed counts and the ICU counts and the ventilator counts. Obviously all that's important, but we cannot say enough things positive about the heroism, but also fatigue and level of infection and illness right now among healthcare workers, not just in New Jersey, around the country. Judy, I don't want to put words in your mouth before we take a couple of questions. The modeling, which I know you're constantly updating, I wouldn't call this a silver lining, but the modeling, this thing comes to a head based on the models here within the next sort of week or two. Is that fair to say? I know you're going to update that, but that's sort of the time frame that we're sort of looking at right now.
Yeah, we were looking at our peak, Governor, around the 14th. That might move up a little bit because we're kind of exceeding what the model shows. So we're updating the model today. And then we take our model, we compare it to the University of Pennsylvania CHIME model. And we're looking at, at the peak, between 6,000 and it could be as high as 9,000 hospitalizations. Hopefully the trajectory goes up as fast, it comes down as fast as it goes up.
Yeah, which it's done in places like South Africa and the UK. So God willing, that happens to us. But those are big numbers, folks. The peak reached in April of 2020, just to remind folks, 8,270 total beds. And again, the good news is we're a ways from that at 4,715, but we're going up a little bit by leaps and bounds every day, overwhelmingly unvaccinated or not fully vaccinated folks. Thank you for that. So Michelle, let's take a few questions. I know there's a lot of balls in the air, so we're not going to be on here forever, but let's take a few. And but by the way, unless you hear otherwise, we're going to be together a week from today. We obviously wanted to be in person today, but that was not to be. But we'll be together, unless you hear otherwise, a week from today at the War Memorial, 1 o'clock in our normal venue. We will be revisiting venue, frequency, other means of communication in this intense period, as you can imagine. Will be health providing. If I continue to test negative, I'll be out there around the state in one form or another, I hope beginning tomorrow. So with that, Michelle.
Okay, we're going to start with Matt Arco.
Hey, Matt.
Good afternoon, Governor. Vault Health said it can't release positivity results for the free at-home test because of its contract with the state. Why is that, and what is the positivity for those tests? Also, why can't people find out what variant they have for a positive Vault test? They said they don't give that out. And also, you were speaking a lot about this today, but again, obviously hospitalizations have increased dramatically since the last time I asked you whether you were considering bringing back a ban on elective surgeries. And given where we are now with the dramatic increase and even on regular divert status, right now there's 4 hospitals that are on full divert, 6 are on emergency divert. How close are you to banning elective surgeries, and what, if you're still not there yet, what is that benchmark?
Got it. All good questions. I'll let Judy and maybe Ed will come in from the bullpen on the question of what variant. Judy, I'm assuming that the rate of positivity, if you're doing an at-home Vault test, you're probably not doing it for the fun of it. You're probably doing it because you've got some amount of concern, and your level of positivity is at least what the state's level is, which is right now in the low 30%. But I'll let you comment on that. And also, Ed, in terms of the variant and why not they may be not disclosing that. On elective surgeries, again, Judy, you should add color here. At the moment, we have no plans for that because hospitals are doing that on their own basis. There's a level, and Judy can go through this, there's a level of urgency. I think it's 1 through 5. You've already got a bunch of hospitals that are taking level 4 and level 5 procedures off the table. And that is what's happening and what we think is the right mix. Obviously, we reserve all options if we have to, but that it is happening as we speak. But with that, any comments on Vault, Judy, or electives, and then Ed, any comments on variants and why or why not they may not be willing to disclose?
Yeah, on the first question about Vault positivity, I mean, we just make the assumption that it's the same as the state. Over 400,000 tests have been requested, but about 40 or 50,000 have been returned. So sample size right now is small, but at the end of the day, the positivity of Vault only is just de minimis in terms of what we're seeing every day in terms of overall test positivity. On elective procedures, elective surgeries, we have levels as the governor shared, 1 through 5. Levels 1 and 2 are trauma and significant surgical emergencies that cannot be delayed. Levels 3, 4, and 5 are less severe or intensive. Level 3 requires a case-by-case evaluation on whether a delay would have subsequent deleterious effects on the individual. And 4 and 5 are truly elective procedures that can safely, without any consequence, be delayed. For hospitals that are in crisis, standards of care, and or on divert, they have already curtailed levels 4 and 5. For hospitals that go on divert, but it's for periods of time as they perhaps clear out their emergency room so they can bring in other people, other individuals. Temporary divert does not require them to curtail as long as they have capacity and staff within the hospital. But all of the hospitals are evaluating. They have pretty rigorous evaluation teams that look at this every day, several times a day.
Any color on variants and why or why not they may not be willing to disclose?
Sure. Vault, like the vast majority of clinical laboratories out there, are running a PCR test. meaning they're running a test to see whether you have the virus or not. They're not running through the sequencing testing on most or almost all of the samples that are being provided to them. So that's why people aren't routinely getting back a result, because that test isn't routinely being run. As part of the state's and the CDC's overall surveillance systems, we do take a subsample of clinical labs and do sequencing on them. I don't know specifically if or how many we take from Vault, but it would not be a test that would be routinely done every time you send in a PCR test to Vault or anywhere else, LabQuest or Quest, LabCorp or Quest wouldn't give you those results either, because they're not being done.
Thank you, Ed. Good to see you. Happy New Year. Michelle, what do you got?
All right, we will go to Ken Burns.
Hey, Ken,
Happy New Year, Governor. How are you?
are you wearing my mask?
Yes, I am.
Just checking. Thank you.
One for you and one for the commissioner. Starting with the commissioner, you mentioned the staff shortages at hospitals. I was wondering if you could provide some color on how bad it is for New Jersey, since you mentioned putting a request in for a federal strike force to come in to help out with the medical capacity. And to the governor, this is more of a technical question as far as the administrative extension that you requested from the legislature. For those who are not familiar with it, like you and I, could you describe what that would mean for the common, or I shouldn't say common, but for the everyday New Jerseyan?
Good questions. I'll ask Paramel to come in after Judy on the second one, but I would just say this: the staffing challenge is to use a technical term, bad. It's bad in both hospitals and long-term care. There's just no other way around it. Judy can give you some more specifics. Frankly, Ken, I think the biggest, most visible reality, and again, it brings us zero joy, is masking in schools and childcare facilities for an extended period of time, and I hope not for that long an extended period of time. That to me is the most visible piece of this, but I'll ask Paramel to come back in after Judy. Judy, how tough is it? How would you quantify the staffing challenge?
The conversations that we've had with both long-term care and with our hospitals is to plan for and anticipate that 30%, at a minimum, 30% of their employees may be out sick at any one given time. That follows the positivity that we're experiencing throughout the state. In planning for 30%, there's 3 levels of staffing. There's conventional staffing, which is your everyday staffing models. There's contingency staffing, where you stretch those models, maybe increase ratios a bit. You stretch the hours of operation of individuals, meaning they work more than an 8-hour shift. They may work 10 or 12 hours, as we saw last April. And then there's crisis standards, where you totally change the way you take care of patients, making sure that all of the necessary and immediate needs are taken care of patients with the right skill mix. So you develop teams of specialists who visit patients every day. They round every day, rather than teams of people having 6 to 8 patients. They may have 15, but the skill level is at the highest level to be able to take care of the most immediate needs appropriately. All of the hospitals are aware of conventional contingency and crisis staffing, and all of them are planning for a 30% decrease in staff complement. They're redeploying administrative individuals to help out on the front-facing direct patient care activities. We have signed a waiver allowing our EMTs, a very valuable and extensive group of individuals, to be able to go into the vaccination sites and help with vaccination, so that the clinical people that are manning those sites can go back into the hospitals and the long-term care facilities. So we're trying to cover all bases for what we call crisis standards.
Thank you, Judy, for that. Paramel, what else would the man on the street feel or see by the extension of these directives?
Yeah, and I think the commissioner just pointed out that the Department of Health has issued a whole series of administrative orders, directives, and waivers to facilitate the government's response to the pandemic. So that's everything from vaccinations to testing to resource allocation to data sharing. So much of that is done through either changing the rules or regulations that are in place or relaxing them to allow greater flexibility, particularly with regard to healthcare facilities and healthcare personnel.
Well said. Good questions, Ken. Thank you all. Michelle, let's do a couple more if we can.
Great. Next question will come from Joey Fox.
Hey, Joey.
Good afternoon, Governor. I've got a few non-COVID questions here. I'll try to talk as fast as I can. So first, can you provide one last lame duck update on Rachel Weiner Apter's Supreme Court nomination? And do you have a timeline yet for the process to replace Justice Faustino Fernandez-Vina, who will be term limited out pretty soon? Next, right before the holiday season, you endorsed Bob Menendez Jr. for Congress. Do you see it as at all problematic for the son of a powerful politician to be anointed as the frontrunner for a seat? And do you support reforming or eliminating the party line system that allows politicians like Menendez Jr. to become such dominant frontrunners? Do you have any comment on Redistricting Commission tiebreaker John Wallace's reasoning that he picked the Democratic congressional map this time around because the Republican map was picked last time? And finally, do you agree with the New Jersey Supreme Court's decision to overturn the conviction of Michelle Ludzinski? Thank you.
Thank you, Joey. No update on either of the Supreme Court justices that you asked about, other than to say that we've got and we've enjoyed and we continue to enjoy very good partnership and deliberations with our legislative colleagues in these cases, obviously in the Senate side of the House. I'm confident that we'll have a good result and no news to break on Justice Faustino. I happen to know Rob Menendez independent of his dad. I'm obviously a huge fan of his dad. But Rob, I know of on his own merits, and I'm a huge fan. And so they are indeed father and son, but I know them each as their own person and as their own public servant. Rob, in the early days of the Port Authority, has been an outstanding commissioner, and I've known him well before that as well. And I'm honored to have endorsed him, and I think he will, assuming he wins, he's going to be an outstanding representative for our state and for that district. No comment specifically on the map, other than listen, I've got unlimited regard for Justice Wallace. I think he was the right person to be in that seat, and I'm very gratified that Chief Justice Rabner put him in there. I think the commissioners each did an outstanding job. Obviously, the six on our side of the aisle are the ones I know best, and we shall see. I'm mostly, we don't talk about this much, but I'm mostly gratified that New Jersey is growing, that people are moving here, not just because of the pandemic, but that the census showed that, and that we're going to be in the happy position for the next 10 years of retaining 12 representatives in the House of Representatives, regardless of which side of the aisle they come from. That to me is the big news, and I hope that number goes up in the decades ahead. And I've got no comment on the case. I would not have any reason to, other than God bless that little guy who we know sadly was taken from us many years ago. Thank you for that. Michelle, let's do one more if we can.
Okay, then your last question will come from Dan Munoz.
Who was it? Sorry, Daniel?
Yes, Daniel Munoz.
Hey, Daniel.
Hey, can you hear me?
I can.
Hi, Governor. Hope you're doing well, all things considered.
Same.
Yeah, thank you. I guess one off topic, with the state bank that you proposed, where do you see that going in your second term? And is that something that you could see happening in these next 4 years? Do you think the pandemic and its recession have demonstrated the need for such an institution, or are there better alternatives? With many towns enacting mask mandates and many businesses and hospitals and doing their own quasi restrictions, do you think it's going to fall to the state to do new restrictions, or is it going to be up to these individual entities, so towns, counties, businesses, and hospitals? I guess what would we need to be seeing in terms of hospitalizations and intensive care utilization in order for you to declare that there is indeed a shortage, and that something more needs to be done in terms of state restrictions? And I guess given sort of how the situation in COVID has deteriorated and just how the sheer anxiety and fear that New Jerseyans have had, do you think that maybe the vacation that you took might not have been the best time thing to be doing, just given how the pandemic has worsened so much and how scared and anxious people are right now? Thank you.
Let me go through these in order. The state bank, I think some version of that is going to come to pass. We had a good meeting on that just before the Christmas holiday. There is an outline of a way forward. And I think you're going to see real progress on that front. That's been one of the harder ones for us to get done for a lot of legitimate reasons. It looked like it was easier from the outside. You get into the office and you realize some of the stuff isn't as easy as you would hoped. That's on that list. And I do think the pandemic and the challenges that individuals, families, businesses, municipalities, particularly students with college loans, I think it has sharpened the need for this as opposed to lessen the need for it. Paramount will correct me if I'm wrong, but I believe it was last June I signed an executive order that indeed explicitly allowed individual communities to take steps as you are seeing in communities around the state, because we had a lot of folks legitimately asking us for that ability. Early on in the pandemic, we were worried about unintended consequences. That's when we knew little. In other words, if restaurants were open on one side of the Hudson versus the other, or in Essex County, but not in Hudson County, or you had mandate here and not there, would you have a tilt and have unintended consequences and capacity issues, et cetera? That's just something that we're just not as concerned about. Folks understand overwhelmingly the need to wear a mask. They understand that it's not going to be the trigger in most cases between whether I go to restaurant A or restaurant B or hospital A or hospital B. And that's the way we had wanted it. So the fact that you're seeing these mandates get put in place is something that we had anticipated. We, in fact, I'd say more than anticipated, frankly, welcome, because we thought this was the right, you make the decision based on the local reality. I think you asked about, on what basis would you see a need, any numbers or not? Listen, we leave all options on the table, but I do want to review a couple of numbers. We have this one I went through earlier. We have 4,715 hospitalizations as of last night. The peak in April of 2020 was 8,270. We have in our ICU units 644 as of last night. The peak also in April of 2020 was 2,080. So you're in one respect less than half of that capacity, and the other less than a third. Just to put some perspective around this, obviously you keep all options on the table. Frankly, this is echoing two exchanges we've had already in this call. Number one, you're going to see number one, staffing is going to be probably the constraining factor here, as opposed to hard beds or PPE or ventilators. And secondly, that's going to inform a strategy that you heard us talk about a little while ago, which is densification on our hospital campuses, to allow us, that's one way, not the only way, but one way for us to address the staffing challenges. Listen, Daniel, given it's been about 650 days of this pandemic, I've gone away for 2 8-day periods. So that's 16 days out of 650. Why? You gotta at some point spend time with your family and reboot. Secondly, I've got the best lieutenant governor in America as my partner, with great leadership around her and around me, including Judy, Pat, Ed, and many others. And thirdly, in today's day and age, I'm in my home in Middletown, but if I told you I was somewhere else, the fact of the matter is we run a state today overwhelmingly remotely on phones, on Zooms, and trust me, we're never far from where we need to be. I promise you that. And by the way, I would say that to everybody. The reward for spending time with your family is worth it. You do it responsibly, safely, you stay in touch, you get a lot back for that. With that, I want to thank on behalf of Judy, Pat, Ed, Paramel, the rest of the team, including our outstanding sign language folks who have been with us from moment one at every single one of these press conferences, and they deserve a huge shout out. Thank you, folks. Get vaccinated, get boosted, have your seatbelt on for the next week or two. We will be together again in person, unless you hear otherwise, in Trenton a week from today at 1 o'clock. We'll be, God willing, at health providing around the state for one reason or another over the course of the days between now and then. And obviously, if we need to report to you, we will report back to you as and if and when we need to. Please stay safe. Do not underestimate for 1 second how transmissible this is. Ed would want me to say that. Judy would want me to say that. This thing is crazy transmissible. But if you've done the right thing, double vax, boosted, wear a mask, preferably double masks, keep social distance. You use your head when you're indoors in particular. You wash your hands with soap and water. Judy would want me to say that. You do all of the above. You may get it, but God willing, overwhelmingly, the evidence says you're not going to the hospital, you're not getting severely ill. Let's hope it stays that way. God bless everybody. Take care and stay safe.